Researchers at the World Health Organization will visit the city of Wuhan, China, Thursday to begin their investigation into the origins of the coronavirus pandemic. The virus was first detected in the city in December of 2019. And while the visit has been expected for months, the WHO's chief has expressed frustration in the last week over arrangements taking too long to be finalized. Meanwhile, the U.S. is moving on to the next phase of vaccinations, with major expansions coming to immunization sites at places like stadiums and convention centers. And the effort couldn't come soon enough. The nation's 7-day average of virus-related deaths now stands at over 3,000 a day. So for more on all of this, let us bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. Okay, so all things coronavirus that we've learned so far. Moderna is saying that its COVID-19 vaccine will offer immunity that could last at least a year. How is something like that determined? Is there anyone who's actually had this vaccine for a year, like including the clinical trials?
No, there's no data for this. This is just an assumption, and we'll have to test this in the people who are in the study who got the Moderna vaccine first. It's a theory. They're very happy with the antibody response that their study members have had, so they feel that it's going to last, but there is no proof for this assertion.
After an 18-hour flight from Dubai to New Zealand in September, local health authorities discovered evidence of an outbreak that most likely occurred during the trip. A new study used the trip to look into how transmission of the virus can occur on a relatively empty flight, even when airlines and passengers are aware and they're more cautious. So what should airlines and passengers take away from this data? I know that in the past we talked about how safe it is to fly, given some of the other things that people are doing. But what does this tell you?
Well, in this actual flight, they weren't required to wear masks. So at least 2 of the people who had coronavirus unknowingly weren't wearing masks. And they also said that in the lounge area before you got onto the flight, you weren't required to wear masks. So I think out of the people who were positive, there were 7. They were sitting within 4 rows of each other, and 2 of them definitely weren't wearing masks on the flight. So even though the flight wasn't crowded, there weren't universal requirements of a mask or a face shield or eye protection, anything like that. It also said that some of the people who were tested 5 days before the flight, not just immediately before the flight. So they were all found to be positive once they arrived to New Zealand in that 14-day quarantine period. So if perhaps if they had testing like that day at the airport, they might have picked up those asymptomatic patients who didn't know they had coronavirus as well.
There's another study that I want to talk about, published in the journal Science. It found that the human body typically retains a robust immune response to the coronavirus for at least 8 months after infection. What more can you tell us about that? I was kind of surprised about the 8 months, because I had heard, something before, I think, that indicated that the immunity would be much shorter than that.
So what we test in the labs usually is an antibody response, which is a B-cell response. And that's when people want to know, like, oh, did I have coronavirus? Can you please test me? And that's going to test your B-cell response, your antibody response. But we have 2 immune systems. We have a humoral immune system and a cellular immune system. So the T cells, which are the humoral immune system, we don't measure because it's just a very difficult test to do. It really has to be done in the hospital under certain circumstances. And that's your memory T cells. So we actually believe that these humoral T cell response will last much longer and offer protection for maybe 8 months and longer, we hope. And that's maybe why as many people aren't getting reinfected. Some people just don't have as strong an immune system as others. And there's about 10% of people who, when they do have COVID, it actually wipes out their immune system. They're not doing well. They have this horrible response. But for the most part, we think that the T cell memory cells are the ones that are helping people not become reinfected.
Doctor, you can now buy at-home coronavirus tests on Amazon. It's called the Dexterity COVID-19 Saliva Kit, and it received emergency authorization last month from the FDA. What do we know about this test? How effective is it? And are there any concerns over people testing themselves instead of having professionals administer the test? There are very few tests. People can correct me if I'm wrong, but there are very few tests, other than, I guess, a home pregnancy test, that you doctors allow us patients to do at home, right?
I think my feeling is the more testing, the better. So if you can buy these tests, they're saliva tests. Now for children, it's usually about 3 mLs of saliva, which is a lot of saliva for a child to produce. So we don't really recommend them with kids because it takes like a whole day to collect that spit. But I think if you want a group of people tested at work or for a meeting, I think the more testing we do, the better, because it does pick up the asymptomatic cases, and we are seeing so many asymptomatic cases. So the saliva tests are pretty reliable. They've been pretty good thus far. This test has to get sent to LA, and then they do the testing, and you get the results in 24 to 72 hours. The only thing is, you have to remember, after you do your test, you really need to quarantine, because if you do the test and you just keep on going about life, you could be re-exposed anywhere else. And I think that's the bigger problem.
Oh, I thought that the test would actually give you the result. If you got to send it, you got to wait like 2 or 3 days. I mean, might as well go see my doctor.
Yeah. Exactly.
Yeah. And I think the test is also available beyond Amazon. There's some big box stores that I think that have them as well, just so people know. On to another test. LA County health officials say that they're going to stop using a commonly used coronavirus test after the FDA raised questions about its accuracy. The test is known as curative tests. Are these tests different than the PCR or the rapid tests? And why might curative tests still be used in other parts of the country?
So the curative test, I actually didn't know much about it until I read the article. It's a cheek swab. And I just think a cheek swab is just not getting that nasopharyngeal swab where the coronavirus really likes to live. I mean, that's why we lose our sense of smell. So we really need a nasopharyngeal or nasal passage swab, or even a throat swab. But a cheek swab is just not going to be as accurate and pick up as much coronavirus. They've had many, many false negatives. And I think they should just... I know that they are going to keep on using them because I think they invested the money in them. And it says that now that this test should really only be used for symptomatic people, because it'll have a better value if you test a symptomatic than an asymptomatic person, just because it's a weaker test. But I think that people are just desperate and the money is running low, so they're going to keep on using them. But they really should just be put aside and not used anymore, is my opinion.
All right, Dr. Dyan Hes, always great to have you. Thank you so much.
Thanks. Bye-bye. Have a good week.